Hello, mommies! Thank you that you are with me again. Motherhood is the greatest thing and the hardest thing. Parenting is raising a child to the best that you can be. In today's video, I'll talk to you about the most common infant rashes plus home remedies. And as an experienced mom and as a registered nurse, I'll share with you how I manage to treat my kids at home. Because of pandemic, we cannot get out to seek help to a doctor. So without further ado, let's begin.
Sia and Sai and more. This is my family. Meet my brother Sai. Then I'm Sia. Two inventor cute. Set free. In the Philippines. Like the video, subscribe, get notified.
Disclaimer, I'm not a doctor. Always consult your doctor if you have any question. Most common problem of infant. Baby acne. Baby acne is usually characterized by small red or white bumps on a baby's cheeks, nose, and forehead. It often develops within the first 2 to 4 weeks after birth. Many babies also develop tiny white bumps on the nose, chin, or cheeks. These are known as milia. Baby acne is an acne that develops on the newborn skin. Baby acne can occur anywhere on the face, but usually appears on the cheeks, nose, and forehead. Baby acne is common and temporary. There's little you can do to prevent baby acne. Baby acne usually clears up on its own without scarring. Home remedies. These tips are useful for caring for your baby's skin while he or she has acne. Keep your baby's face clean. Wash your baby's face daily with warm water and mild baby soap. Dry your baby's face gently. Simply pat your baby's skin dry. Don't pinch or scrub the acne. You may cause more irritation or an infection. Avoid using lotion or oils on your baby's face. Cradle Cup. Cradle Cup causes crusty or oily scaly patches on a baby's scalp. The condition isn't painful or itchy, but it can cause thick white or yellow scales that aren't easy to remove. Cradle Cup usually clears up on its own in weeks or a few months. Home care measures include washing your baby's scalp daily with a mild shampoo. This can help you loosen and remove the scales. Don't scratch Cradle Cup. If Cradle Cup persists or seems severe, your doctor may suggest a medicated shampoo, lotion, or other treatment. Symptoms. Common signs of Cradle Cup include patchy scaling or thick crust on the scalp, oily or dry skin covered with flaky white or yellow scales, skin flakes, possibly mild redness. Similar scales may also be present on the ears, eyelids, nose, and groin. Cradle Cup is common in newborns. It usually isn't itchy. Cradle Cup is the common term for infantile seborrheic dermatitis. It's sometimes confused with another skin condition, atopic dermatitis. A major difference between this condition is that atopic dermatitis usually causes significant itching. Home remedies. The following over-the-counter treatments and home care tips can help you control and manage Cradle Cup. Gently rub your baby's scalp with your fingers or a washcloth to loosen the scales. Don't scratch. Wash your baby's hair once a day with mild baby shampoo. Loosen the scales with a small, soft bristled brush or fine-toothed comb before rinsing off the shampoo. If the scales don't loosen easily, rub petroleum jelly or a few drops of mineral oil onto your baby's scalp. Let it soak into the scales for a few minutes or hours if needed. Then brush and shampoo your baby's hair as usual. If you leave the oil in your baby's hair, the Cradle Cup may get worse. Once the scales are gone, wash your baby's hair every 2 to 3 days with a mild shampoo to prevent scales buildup. Diaper rash. Diaper rash is a common form of inflamed skin that appears as a patchwork of bright red skin on your baby's bottom. Diaper rash is often related to wet or infrequently changed diapers, skin sensitivity, and chafing. It usually affects babies, though anyone who wears a diaper regularly can develop the condition. Diaper rash can alarm parents and annoy babies, but it usually clears up with simple at-home treatments such as air drying, more frequent diaper changes, and ointment. Symptoms: diaper rash is characterized by the following. Skin signs: diaper rash is marked by red, tender-looking skin in the diaper region, buttocks, thighs, and genitals. Changes in your baby's disposition: you may notice your baby seems more uncomfortable than usual, especially during diaper changes. A baby with a diaper rash often fusses or cries when the diaper area is washed or touched. Causes: diaper rash can be traced to a number of sources including irritation from stool and urine. Prolonged exposure to urine or stool can irritate a baby's sensitive skin. Your baby may be more prone to diaper rash if he or she is experiencing frequent bowel movements or diarrhea, because feces are more irritating than urine. Rubbing: tight-fitting diapers or clothing that rubs against the skin can lead to a rash. Irritation from a new product: your baby's skin may react to baby wipes, a new brand of disposable diapers, or a detergent, bleach, or fabric softener used to launder clothed diapers. Other substances that can add to the problem include ingredients found in some baby lotions, powders, and oils. Bacterial or yeast infection: what begins as a simple skin infection may spread to the surrounding region. The area covered by a diaper, buttocks, thighs, and genitals, is especially vulnerable because it's warm and moist, making a perfect breeding ground for bacteria and yeast. These rashes can be found within the creases of the skin, and there may be red dots scattered around the creases. Introduction of new foods: as babies start to eat solid foods, the content of their stool changes. This increases the likelihood of diaper rash. Changes in your baby's diet can also increase the frequency of stool, which can lead to diaper rash. If your baby is breastfed, he or she may develop diaper rash in response to something the mother has eaten. Sensitive skin: babies with skin conditions such as atopic dermatitis or seborrheic dermatitis or eczema may be more likely to develop diaper rash. However, the irritated skin of atopic dermatitis and eczema primarily affects areas other than the diaper area. Use of antibiotics: antibiotics kill bacteria, the good kinds as well as the bad. When a baby takes antibiotics, bacteria that keep yeast growth in check may be depleted, resulting in diaper rash due to yeast infection. Antibiotic use also increases the risk of diarrhea. Breastfed babies whose mothers take antibiotic are also at increased risk of diaper rash. Home remedies: generally, a diaper rash can be treated successfully at home with these practices. Keeping diaper area clean and dry. The best way to keep your baby's diaper area clean and dry is by changing diapers immediately after they are wet or soiled, until the rash is better. This may mean getting up during the night to change the diaper. After you've gently cleaned and dried the skin, apply a cream, paste, or ointment. Certain products such as zinc oxide and petroleum jelly work well to protect the skin from moisture. Don't try to scrub off this protective layer completely at the next diaper change, as that could hurt the skin more. If you don't want to remove it, try using mineral oil on a cotton ball. Increasing airflow. To aid the healing of diaper rash, do what you can to increase air exposure to the diaper region. These tips may help air out of your baby's skin by letting him or her go without a diaper and ointment for a short period of time. Perhaps 3 times a day for 10 minutes each time, such as during naps. Avoid airtight plastic pants and diaper covers. Use diapers that are larger than usual until the rash goes away. Applying ointment, paste, cream, or lotion. Various diaper rash medications are available without a prescription. Talk to your doctor or pharmacist for specific recommendations. Zinc oxide is the active ingredient in many diaper rash products. They are usually applied to the rash throughout the day to soothe and protect your baby's skin. It doesn't take much. A thin covering will do. The product can be applied over medicated creams such as antifungal or a steroid when necessary. You could also apply petroleum jelly on top, which helps keep the diaper from sticking to the cream. Ointments, pastes, or creams may be less irritating than lotions. But ointments and pastes create a barrier over the skin and don't allow it to receive air. Creams dry on the skin and allow air through. Talk with your doctor about what type of product would be better for your child's rash. As a general rule, stick with products designed for babies. Avoid items containing baking soda, boric acid, camphorphenol, benzocaine, diphenhydramine, or salicylates. These ingredients can be toxic for babies. Bathing daily until the rash clears up. Give your baby a bath each day. Use warm water with mild fragrance-free soap. Eczema. Eczema or atopic dermatitis is a condition that makes your skin red and itchy. It's common in children but can occur at any age. Atopic dermatitis is long-lasting and tends to flare periodically. It may be accompanied by asthma or hay fever. No cure has been found for atopic dermatitis, but treatments and self-care measures can relieve itching and prevent new outbreaks. For example, it helps to avoid harsh soaps, moisturize your skin regularly, and apply medicated creams or ointments. Eczema signs and symptoms vary widely from person to person and include dry skin, itching which may be severe especially at night, red to brownish gray patches especially on the hands, feet, ankle, wrist, neck, upper chest, eyelid, inside the bend of the elbows and knees, and in infants the face and scalp. Small raised bumps which may leak fluid and crust over when scratched. Thickened, cracked, scaly skin. Raw, sensitive, swollen skin from scratching. Atopic dermatitis most often begins before age 5 and might persist into adolescence and adulthood. For some people, it flares periodically and then clears up for a time, even for several years. Causes. Healthy skin helps retain moisture and protects you from bacteria, irritants, and allergens. Eczema is related to a gene variation that affects the skin's ability to provide this protection. This allows your skin to be affected by environmental factors, irritants, and allergens. In some children, food allergies may play a role in causing eczema. Home remedies. Identifying and avoiding skin irritants. Avoiding extreme temperature. Lubricating your baby's skin with bath oils, creams, or ointments. See your baby's doctor if these measures don't improve the rash or if the rash looks infected. Your baby may need a prescription medication to control the rash or to treat an infection. Your doctor may also recommend an oral antihistamine to help lessen the itch and to cause drowsiness, which may be helpful for nighttime itching and heat rash. Heat rash, also known as prickly heat and miliaria, isn't just for babies. It affects adults too, especially during hot, humid weather. Heat rash develops when black pores trap perspiration under your skin. Symptoms range from superficial blisters to deep red lumps. Some forms of heat rash feel prickly or intensely itchy. Heat rash usually clears on its own. Severe forms of the condition may need medical care, but the best way to relieve symptoms is to cool your skin and prevent sweating. Symptoms. Adults usually develop heat rash in skin folds and where clothing causes friction. In infants, the rash is mainly found on the neck, shoulders, and chest. It can also show up in the armpits, elbow, creases, and groin. Causes. Heat rash develops when some of your sweat ducts clog. Instead of evaporating, perspiration gets trapped beneath the skin, causing inflammation and rash. Home remedies. Tips to help your heat rash heal and to be more comfortable include the following. In hot weather, dress in loose, lightweight clothing that wicks moisture away from your skin. Spend as much time as possible in air-conditioned buildings. Bath or shower in cool water with non-drying soap. Then let your skin air dry instead of toweling off. Use calamine lotion or cool compresses to calm itchy, irritated skin. Avoid using creams and ointments that contain petroleum or mineral oil, which can block pores further. Drool rash. Drool rash is not contagious and is not linked to any underlying medical conditions. However, it can result in red, itchy, bumpy patches on the skin, which babies may find painful and uncomfortable. These patches may be moist or dry. Drooling is a natural process and may also be a side effect of teething, which is when a baby's teeth start to break through their gums. Drooling may begin long before the teeth come and persist long after. However, besides teething, babies may also naturally drool due to their limited ability to swallow, lack of front teeth, tendency to keep their mouth open. Treatment. Parents and caregivers can take simple measures to reduce the impact of drool rash. The best way to treat drool rash is to keep the baby's skin dry throughout the day and prevent new rashes from developing. Home remedies. Always keeping clean cloth or baby wipes handy and wiping the child's face dry as soon as any drool appears. If baby wipe seems to be worsened the irritation, try plain water or a soft dry cloth. If teething seems to be causing the baby to drool, try giving them a teething toy or something cold to chew on, such as teething ring from the refrigerator. Applying an emollient, barrier cream or ointment to the affected area to help protect and heal the baby's skin. However, it is the best to consult a doctor before using any products, especially near the baby's mouth. Avoiding using irritating substances on or around the baby, such as harsh laundry detergents, soaps, and scented lotions. Try replacing these products with mild fragrance-free alternatives. Always cleaning and sterilizing the baby's bottles and pacifiers to ensure that these are not the cause of the rash. Parents and caregivers should replace or limit the use of any objects that appear to cause or worsen the rash. Gently washing the rash with tepid water and patting it dry after. Thank you for watching. Don't forget to like, share, and subscribe.